2. Materials. 3. Safety and first aid. In this chapter, you will learn about safety from fire, first aid for cuts and scratches, for nose bleeding, for fractures, for sprains, for burns, for food poisoning. Accidents can occur anywhere at any time. We need to follow certain safety rules to avoid them. Safety from fire. A fire can break out for many reasons. Some of the reasons are given below. Carelessness while handling candles, firecrackers, and matches. Leakage of gas in the kitchen. Electrical faults. The following rules can help in preventing fire. Be careful while handling fire. Take care while playing with firecrackers. Do not wear synthetic clothes while burning firecrackers or while cooking, because synthetic clothes catch fire easily. If there is gas leakage, open doors and windows. Do not operate any electrical switch or light a match. Check all electrical appliances and wiring regularly. We can put out a fire by the following methods. If a fire breaks out, inform the nearest fire station should be informed. Firefighters normally put out fires using a fire engine. There must be 1 or 2 fire extinguishers in homes and at workplace. They help us to put out sudden fires. If the fire is due to electrical faults, do not pour water to stop the fire. Use sand or a fire extinguisher. If a person's clothes catch fire, wrap a thick blanket around his body. If possible, ask him to roll on the floor. First aid. First aid is the first medical help we give to an injured person before a doctor arrives. It is very important to stay calm while giving first aid. Here are some ways to give first aid. For cuts and scratches, we should not neglect any wound. Sometimes a minor cut can pose a big problem. Germs can enter a body through cuts and wounds and cause infection. Wash your hands before giving first aid, as germs from dirty hand can infect the wound. Remove all dirt around the wound. Clean the affected part with cotton wool soaked in antiseptic lotion. Place a thick pad of cotton wool or sterilized gauze on the wound and press it with your thumb and fingers. This will stop bleeding. You can use tourniquet to stop bleeding. It is a bandage tightly tied over the wounded area. When a cut is caused by a dirty or rusted object, germs may enter and cause a disease called tetanus. Consult a doctor for any anti-tetanus medicine. For nose bleeding, keep the victim upright in a comfortable position with his head held back. Press the bleeding side of the nose firmly. Keep an ice pack or wet cloth on the nose and head. Ask the victim to breathe through his mouth. Ask him not to blow his nose. A little bit of bleeding from the nose is harmless. If the bleeding is heavy, consult a doctor. For fractures, a break or a crack in a bone is called a fracture. If a person has a fracture, he must not move the fractured part. Keep the patient calm and comfortable. Apply a splint to give support to the broken bone and try to avoid movement. We can use things like sheets of papers, magazines, a piece of cardboard, or a pillow around the injured bone as a splint. This will prevent movement. A long piece of cloth can be used as sling for support. For sprains, when the tissues round a joint are injured, we call it a sprain. Then we see swelling and discoloration near that part. There is pain also. Remedy: place ice packs or ice cubes on the injured joint till the swelling subsides. For burns, burns are very painful. You can treat minor burns at home. Consult a doctor for major burns. In case of minor burns, let cold water flow over the burn until the pain subsides. An antiseptic lotion or cream can be applied to prevent infection. A paste of baking soda and water also work if an antiseptic lotion is not available. In case of major burns, blisters are formed. Do not prick a blister. An open blister is an open wound. It can catch infection. Remedies: gently cover the burn with sterilized gauze or a clean piece of cloth to protect it from germs and dust. If the victim is in a state of shock, give him a warm drink. If the burns are big, consult a doctor. In case of chemical burns, remove any clothing from the burnt part. Wash off the chemical with plenty of water. Do not rub the burnt skin. Cover the burn with sterilized gauze. Take the victim to a doctor. For animal bites, first wash the wound with soap and water to remove the animal saliva. The saliva of the animal may cause rabies or hydrophobia. Dogs, wolves, and monkeys are known to carry the rabies virus. Apply an antiseptic lotion to prevent infection. Bandage the wound with a sterile gauze. Take the victim to hospital immediately. Did you know? In case a person has an insect bite, rub a cut onion on his infected part. For snake bite, Snake bites are very harmful. A poisonous snake injects poison into the victim's body. In case of a snake bite, let the poisonous blood flow out. Do not stop the bleeding from the wound. Tie a tourniquet above the bite to prevent the poisonous blood from flowing into the heart. Immediately take the victim to a doctor. It is always better to take precautions when you walk through areas where snakes live. Wear high boots when you walk through wet, grassy land to protect your feet from snakes and other insects. For poisoning, many things like insecticides, pesticides, detergents, naphthalene balls, etc. contain harmful chemicals. If someone drinks these things, call for a doctor immediately. We must tell the doctor about the type of poison consumed. This will help the doctor give the right medicine. Keep all medicines away from the little children. Throw away all medicines that have crossed the expiry date. Outer surface of vegetables and fruits may have poisonous insecticides and pesticides. So, we should wash vegetables and fruits before eating them. In case of any kind of poisoning, try to make the victim vomit. Keep the telephone number of your nearest doctors, chemist, and ambulance ready. In case of an emergency, immediately call for help. Roundup. We must obey safety rules on the road and follow the road signs to avoid accidents. We must be careful while handling fire. In case of a major fire, inform the nearest fire station. Put out the fire caused by electrical faults using sand or a fire extinguisher. Help given to a patient before the doctor arrives is called first aid. Do not neglect a wound because germs may enter it, cause infection. Do not try to move the broken bone before the doctor comes. Put cold water on the burn and apply an antiseptic lotion.